the State Fiscal Year 2026 SUPTRS Block Grant for Primary Prevention Programs Grantee Onboarding Webinar. SUPTRS, as many of you know, is the Substance Use Prevention Treatment Recovery Services Block Grant. And then this is the training for the primary prevention funded grantees. I appreciate you guys all making the time to join today. I know I originally scheduled this for about an hour and a half. I do think we could get it done in an hour, and I've had another meeting come up, so I can be late to that meeting if need be. I want to provide time for us to go through all this, but I'm going to aim for getting this all through in an hour, so I might go a little bit fast. But the agenda today, so some of the things I wanted to go over, I wanted to give an overall ODP update. Our agency is in the midst of some transitions, so give you guys an update on that. And then do an overview of the SUPTRS Block Grant Primary Prevention Funds, quickly touch on the program objectives and impact, talk about next steps, so the required documentation that grantees need to submit, the CPS and PPS credentials, getting set up in the state's payment system, and then go through grantee responsibilities, accessing the grant funds, using Neighborly, submitting reimbursement requests, doing the quarterly activity reports, program participant surveys and whatnot, and the grant timeline. So it's a bit about what we're going to go through today. And I guess I can also start off with an introduction. My name's Jessie Dexter. I'm the Block Grant Director here with ODP. Most of you know me. I might be new to a few, but I've been with ODP. I just hit my 5-year mark in May. I started off as the Program Planning and Development Specialist and then transitioned into this role when Marianne King was appointed to the director position about 3.5 years ago now. So giving some updates on ODP as a whole. As many of you know, Marianne King retired on June 30th. She was with ODP for 12 years and did incredible work for our agency and was our fearless leader. So that was a very, very, very sad loss. And yeah, that was a big day for our office. Though Marianne, she has 4 grandkids, 4 grandsons, all in the Treasure Valley. And, she has the opportunity to spend much more time with her family and her friends and travel and do all the things that we would all love to do, but we don't get paid to do it. So we're very excited for her to be able to enjoy this next phase of her life. It's very well earned. And I do think she's still going to be involved in prevention in different capacities. I think she's, maybe going to take some time to decompress, and hopefully we can loop her. I'm still trying to find ways to pull her back in all the time. So yeah, I'm sure we won't be seeing the last of her. So the director position for ODP is an appointed position. ODP sits underneath the office of the governor. So the governor appoints the director position. On the last day Marianne was with ODP, we were notified that the governor I have someone in the waiting room. Let me admit them. The governor appointed an interim director. His name's Ross Edmonds. He is also the division administrator for the Division of Behavioral Health at the Idaho Department of Health and Welfare. At that position, he kind of oversees about 800 employees across the state, and oversees the mental health block grant, the SUPTRS block grant, and the 3 state hospitals and all kinds of stuff. He has a lot going on over there. So he is our interim director. And, but very nice, great guy. It's been great getting to know him as we kind of navigate this transition and iron out how we're going to move forward. But that does lead me into a bit of an ODP agency transition. So Idaho House Bill 364 and the Idaho Legislature DOGE Task Force. So the Idaho legislators' DOGE Task Force, it's kind of built after and named after the Federal Department of Government Efficiency, which you may have heard about. That's at the federal level, Elon Musk, all that jazz. So this DOGE Task Force met for the first time in the first week of July at the Capitol. This committee is built on Idaho House Bill 364. This House bill during the 2025 legislative session, it was passed by the House, but it stalled in the Senate. Although the DOGE bill died during the Idaho legislative session, the Idaho GOP legislative leaders announced the creation of the DOGE Task Force in April. The committee's directive is to look into 3 primary focus areas: examine all departments and divisions for reduction, consolidation or elimination, eliminate unnecessary employee positions, and evaluate state travel. So per the Idaho Legislative Services Office, in 1970, the state of Idaho passed a constitutional amendment to consolidate government programs into no more than 20 executive branch departments, excluding the offices of Idaho's 7 constitutional officers. So within each of the departments, there are many subunits. For instance, within the Office of the Governor, there are many other organizations, such as the Idaho Commission for the Blind or the Idaho Office of Drug Policy. And I read that off. That's a quote directly from a news article from the Idaho State Journal, or I think it's Idaho State Journal, which I can share out with you all when I send out the recording and follow up from this webinar. So the governor's office has quite a few agencies underneath of him. There's also, I think, like minerals, resource exploration, there's species conservation. A lot of these small agencies that have been created over the years kind of exist underneath the governor's office. And ODP appears to be one that has been explicitly kind of publicly identified as one that they're looking to find ways to or streamline the government a bit. So while some state agencies like the State Board of Education are set forth in the state constitution, others like ODP exist in statute. So like I said, ODP is located under the governor's office, and we were created in statute in 2007. At this time, ODP and our statute are being evaluated, and while nothing has been officially confirmed with the ODP team, it appears very strongly that the plan is to transition ODP into the Idaho Department of Health and Welfare, which also makes sense, with Ross being our interim director and the division admin for the Division of Behavioral Health at Health and Welfare. However, since ODP exists in statute, we will continue to exist as we are through June of 2026, because since we exist in statute, we can't merge into health and welfare easily. The legislature has to pass legislation to dissolve and or amend our statute and Idaho code. So our agency's state fiscal year 2026 budget was passed by the Idaho legislature during the 2025 session. So we have our budget set, and ODP will continue to exist as we are through June 2026. And as we go through this evaluation, and I believe there's going to be legislation proposed, and as that goes through the 2026 legislative session, we can keep you guys updated on that. But my strong sense is that come July, they were going to kind of merge ODP with Idaho Department of Health and Welfare, though I have been assured that they want to maintain, kind of the block grant and the work that we do. So I am very hopeful that there won't be significant changes to the block grant as we transition, but we'll navigate that together. But I do think that we're going to be able to keep supporting all of our partners and all the great work that you do. However, in SFY2026, there will be 2 significant changes. They're going to move the physical location of our office. It's my understanding that they're going to move us around the end of October. So that will in some ways change our mailing address. So I'll keep you posted on this when it happens. They're going to move us into a health and welfare building by the end of October of this year. So I'll keep you guys posted on that. And I do not believe they intend to appoint a permanent director for the Office of Drug Policy, as Ross Edmonds is the division admin he's the division admin for the Division of Behavioral Health at Health and Welfare, and already manages about 800 employees across the state. His capacity is somewhat limited. So the ODP team is going to keep functioning as normal, but I have been appointed as the team lead while ODP undergoes our evaluation and or until we are transitioned into health and welfare. So I think this is going to kind of be the structure of things. My guess would be until June of 2026. Ross is not based in our office. He's based over in a health and welfare building. So at least for the next few months, we're a little bit on our own island over here, but then we will be transitioning to health and welfare and physically, and that might lead to some more support, but we'll see how that goes. So now that I am doing the team lead role, I'm doing a lot more support for ODP team members, overseeing a lot of the ODP projects, and I'm doing more of the agency and state reporting and management stuff. So a lot of those things that Marianne was kind of doing, I'll be picking up over the next few months. And this has pulled my attention pretty significantly in recent weeks while we try to get settled and get our new world figured out. But I'm hopeful that I'll be able to provide better support to the SUPTRS Block Grant grantees as we get settled into this transition and kind of are able to delegate roles and responsibilities. But I really appreciate your patience with me and my team while we get our feet under us during this time. I also wanted to provide a federal funding update. I went over this in the email that I sent out, so I don't want to be too repetitive, but I know this federal funding uncertainty can be very stressful for our grantees and our partners. So I want to provide some clarity because this entire process is incredibly confusing. I was very confused about it. I thought that once the One Big Beautiful Bill Act was passed on July 4th, that we would know for certainty about federal funds. But our office, as you may know, also has the Partnership for Success grant that comes through us. That's a grant from SAMHSA. And that grant is a discretionary grant where the block grant, the SUPTRS block grant, and these funds are block grant. Those grants are different. Discretionary grants are a little bit less certain right now, but block grant funds do have a little bit more certainty. So to provide some context on this funding process, the One Big Beautiful Bill Act that was passed on July 4th, it does not determine specific appropriations, such as the budgets of specific federal agencies or grants, like the SUPTRS block grant or the PFS grant. Rather, it provides this budgetary framework within which each of the Congress, House, and Senate sub-appropriations or appropriations subcommittees, they will operate. So the House and Senate have 12 appropriation subcommittees, including the Subcommittee on Labor, Health, and Human Services, Education, and Related Agencies. This is a subcommittee that oversees the appropriations for the U.S. Department of Health and Human Services and SAMHSA. So while the OBBBA and broader budget resolution set the overall budget, the appropriations subcommittees are now tasked with drafting the annual appropriations bills that will dictate the budgets and allocate funds for federal agencies and grants. The House and Senate go on recess in the month of August, and I think they actually took recess a bit early this year. They will be coming back September 1st or 2nd, and we have gotten some updates from some of our federal partners that they don't anticipate a sub-appropriation, like for the sub-appropriations committee that's doing the appropriations for Health and Human Services and SAMHSA, to release a markup of the bill until September 9th. And then it'll go pretty quickly. I think all their budgets and stuff kind of have to be finalized by the end of September because the next federal fiscal year starts October 1st. So that whole process is going to be is a lot more influential for the PFS funding that comes through our office, which is kind of another thing that we're navigating right now because we will not know until September 9th the certainty of the Partnerships for Success grant. And so that grant does fund 1.5 staff in our office, and we have law enforcement grantees and community coalition grantees. So we are kind of in the middle of trying to figure out what our contingency plans are going to be and if and how we can plan for the next fiscal year without certainty on that funding. So that's been another thing that's been kind of pulling me away a little bit, but hopefully come September 9th, we'll have more clarity there. This will not affect the block grant, and that's because the SUPTRS block grant is a formula-based block grant rather than a discretionary grant. Changes to formula grants require congressional approval, and their funding is allocated based on a statutory formula, making them more stable and consistent and less vulnerable to shifts in budget priorities. So because the block grant is a formula grant, SUPTRS block grant funds were officially appropriated through federal fiscal year 2027 via the Consolidated Appropriations Act of 2023, which was signed into law in 2022. So this authorized and appropriated a consistent and designated amount of funding for the SUPTRS block grant for each of the federal fiscal years through 2027. That means that the federal funding for this state fiscal year 2026, SUPTRS block grants is very stable. We know how much we're going to get. It's very, very unlikely that it's going to change. So hopefully that gives you guys some comfort knowing that the funding you were awarded for state fiscal year 2026 for your block grant awards, it's not going to go anywhere. And moving forward into state fiscal year 2027 and beyond, I think there's conversations about maybe merging block grants or whatnot. But, we'll deal with that as it comes. And for the time being, I think we're feeling pretty hopeful. So your grants are all good to go this coming year, and we'll just navigate any things that pops up as we go. Okay, so hopefully that didn't, I think I covered everything. Hopefully that wasn't too much information or too confusing. But we'll move on to kind of an overview of the SUPTRS Block Grant Primary Prevention Funds. So this funding comes from the Substance Abuse Mental Health Services Administration. ODP's SUPTRS Block Grant is one piece of the larger Substance Use Prevention Treatment Recovery Services Block Grant funding. It's the largest federal formula grant that's awarded to states and state agencies to support prevention, treatment, recovery. Previously, this funding was known as the Substance Abuse Block Grant, or SABG, but a couple of years ago, they changed it to the SUPTRS Block Grant. It's the same block grant, but with a new name. So the block grant is administered by the Substance Abuse Mental Health Services Administration, or SAMHSA for short. It comes to Idaho through the Idaho Department of Health and Welfare, and they are required by statute, federal statute, to designate 20% of the grant for primary prevention of substance misuse education and programs. That 20% set aside comes to the Office of Drug Policy, and we have been administering that piece of the prevention funds since 2014. So that means the purpose of the SUPTRS grant funds that ODP manages and allocates out through our subgrantee awards. The goal and purpose is to support the primary prevention of substance use and misuse prevention strategies. Primary prevention means that we support programs and activities that are intended to support individuals that are not identified as being in need of treatment. It's very upstream, with the goal of trying to delay youth initiation of substance use and prevent substance misuse behaviors from really developing, to hopefully ultimately prevent substance use disorders from ever occurring. And we allocate out these funds through community-based grants in communities across Idaho to primary prevention grantees like you guys. So quickly, just a bit about, my slide change, there we go, okay. Quick about program impact. I also went over this last year at our onboarding webinar, and it hasn't really changed, but when we talk about program impact, what we want to know is how many youth and families we reached, of what age groups and populations, and in what regions. This information will be collected via quarterly grant activity reports, and we will dive into those in a little bit later in this webinar. However, just to give you a brief snapshot of the SUPTRS Block Grant impact we've seen over the decade and that we've been administering these grants. As you can see on the slide, since 2011, youth past month use of alcohol and tobacco has been steadily trending downward. Please note that the numbers for the 2011 and 2017 were captured from the Youth Risk Behavior Survey, and the data for 2021 was captured from the Idaho Health Use Survey. Additionally, the numbers for tobacco and our first cigarette use only did not include e-cigarette and vaping, since that was not captured back in 2011. I also think it's worth noting that this data from the Youth Risk Behavior Survey and the Idaho Health Use Survey, it is from 2021. The Youth Risk Behavior Survey was administered by the Idaho State Department of Education, and they discontinued doing that survey after the 2021 administering. And then ODP did do another round of the Idaho Health Use Survey in 2023, but with kind of challenges around youth surveying and surveying youth in schools. That survey, we weren't able to gather enough data to do state level evaluation. So the last state level evaluation outcome data we have from that survey is from 2021 as well. And our office is not going to be doing the Idaho Health Use Survey again. We are actually looking at how to pivot and looking at doing a young adult survey for youth ages 18 or young adults ages 18 to 24, 25, as that population would be less challenging in many ways to survey than youth under the age of 18 now. So that's why this data might seem a little dated. But additionally, ODP also partnered with an evaluation group called Catalyst in 2021 to complete a cost-benefit analysis. And the findings showed that for every $1 of funds invested in substance use prevention, we gained a benefit of $20.63. This clearly demonstrates that the work of prevention providers like you guys implementing comprehensive strategies to affect youth substance use have been effective in utilizing these public funds to reduce youth substance use. Okay, so next, diving into kind of the next steps on getting started with your grant. So gathering required documentation and then submitting it to me. It's all the submission process is a little bit different this year. But some of the required next steps is, making sure you thoroughly review your grant agreement and let me know if you have any questions. We also require all grantees to provide documentation of current liability and workers' compensation insurance. Returning grantees frequently ask me, if I sent my insurance documentation in last year, do I need to send it again? The answer is almost always yes. Proof of insurance documents have a policy start and end date that typically only cover 1 year at a time. So the documentation you provided last year is likely expired or will expire during the upcoming grant year. And then also grantees have to submit current documentation of current cleared background checks for all staff that will be doing direct services with youth and or vulnerable adults. Ideally, if you could get these submitted before the start of program implementation and get the background check process started before program implementation, that would be great. By current background checks, we mean that they are dated within the last 5 years. Returning grantees frequently ask me, if I provided background checks documentation last year, do I need to send it in again? If the background check documentation you sent me last year is still current, dated within the last 5 years, then no, you do not have to send it to me again. However, if it is no longer current, hasn't been completed within the last 5 years, if you have new staff that are coming on and involved in the programming, then yes, you do need to send it in again. ODP will reimburse grantees for the cost of background checks for staff background checks, but please know that we only can reimburse for background checks that were passed and cleared. So you have to, cover the cost of that background check up front, and then once you get notice that it was passed or cleared, then you can request reimbursement from ODP for those expenses, and we'll need copy of that cleared background check. If the background check is failed, then the organization or the individual are responsible for covering that cost. If you are currently employed by an agency or organization that maintains updated background checks, such as a school or school district, then a letter on agency letterhead attesting that a current copy of all the relevant background checks are on file with your employer is acceptable. Okay. The other thing is setting up payment with the state of Idaho. So if you are a grantee that has previously received payment from the state of Idaho and it's, you have that process down, it's all working well, then you're good to go. But if you're a grantee that hasn't previously received payment from the state of Idaho, you will need to get set up as a vendor in the state's payment system. The state's payment vendor system is controlled by the state controller's office. And in the middle of last year, they transitioned to this new system called PaymentWorks. So PaymentWorks is the state's new vendor payee system. Since the state transition to PaymentWorks last year, the process of getting set up as a payee has changed. It used to be that you would go to the state controller's office website, download some forms, and then submit them. Now it's a little bit different, but they, at least as far as I was most recently updated, they haven't finalized it. So what happens is if you need to be set up as a payee this year, if you're a new grantee that hasn't received payments from the state before, send me an email, and then we email the state controller's office, and then they will send you an email through PaymentWorks. And so then that email will include information on the next steps you need to take to get set up as a vendor in PaymentWorks. Sounds confusing, but we can walk through that together as needed. Please note it can take 1 to 2 weeks to get payees set up in the state's payment system. So if you wait to do this until right before you submit a reimbursement request, it will delay your payment. So keep that in mind. Grantees regularly ask me how they will get paid, whether it will be by check or direct deposit. That's all dependent on how you set up your vendor payee account in the state's payment system. We don't keep copy of the materials. We don't have a lot of access into the state's payment system. That information is, confidential. So if you do need to know how you will be receiving payment, you can ask us, and we can ask the state controller's office, or you can contact the state controller's office directly, or you should be able to go to your PaymentWorks vendor payee account and look it up, see it within there as well. So if you received payments previously from the state, if you receive those via check or direct deposit, then however you received payments previously is how you would receive payments from ODP. Lastly, grantees are also required to submit CPS credential documentation by August 31st, or submit PPS, provisional prevention specialist credential documentation by October 31st. I'm going to dive into this a little bit deeper on the following slide. Please note that this submission process for this required documentation will be done differently this year. In past years, grantees submitted all this documentation to me via email. There's a lot of emails from a lot of people at different times, and it becomes a lot to track. So this year, it will be submitted through a JOT form. I've built out a SFY2026 SUPTRS Block Grant Next Steps checklist JOT form, and that JOT form will walk you through all the steps for all of the materials and required documentation and whatnot, so you can navigate all of that. And I'm going to go through that JOT form with you in a bit after I touch on the CPS and PPS credentials. Cool. So CPS and PPS. So the CPS stands for Certified Prevention Specialist. This is a credential that is not managed by ODP. It's managed by IBAD, the Idaho Board on Alcohol and Drug Counselors. I'm drawing a blank on what it's. IBAD, IBADD, I think. So they are the ones who manage the CPS. They manage the CPS requirements and whatnot. The CPS involves completing a certain amount of required educational hours, work hours, training hours, and then sitting for a CPS exam. All of that is overseen by IBAD and isn't managed by ODP. So grantees who do have a Certified Prevention Specialist credential, you will submit that through the Next Steps checklist JOT form. And we do really try to encourage grantees that have received block grant funds for 2 or more years to be working towards having or obtaining that CPS certificate. So grantees that have received block grant funds for 2 or more, the last 2 consecutive years, you either need to provide a copy of your CPS certificate, or you need to submit, fill out and submit the CPS training tracker form, which I can go over in a little bit. This tracker form provides the opportunity to share information on staff training that has been completed and or is planned to be completed to obtain the required training hours to sit for the CPS exam. Let me see. I might just be able to pull that up really quickly to show you what that looks like. Okay. Can you guys see that? You can just give me a thumbs up if my screen changed. It should be an Excel spreadsheet now. Perfect. Thank you. So this is the Certified Prevention Specialist Training Tracker form. It'll be hyperlinked in the PowerPoint. I'll also include it in the follow-up email that I send out after this webinar. But basically, it should all like kind of be functional, but you can put in, you know, conference training. And then I built this out so then you can pick the training type: conference, webinar, online training, in-person training, say conference. Status, completed. Your options are completed, in progress, or planned. So if you have trainings that you plan to go to during this next grant award period during state fiscal year 2026, you can put those in there. If you have trainings in progress, you know, ODP has a number of trainings on our online learning management system. If you have any trainings, those are self-paced and you can kind of go as you have time. So if you have any trainings in progress like those, you can put in progress, the number of hours, and then if there was a certificate provided, and then you can provide some details here. So then as you fill this out, so as you fill this out, this will down here, this will automatically start to pre-populate. There you go. See, so it'll say completed, in progress, planned, how many trainings, and the number of hours. So yeah, just fill this out. And then this would be a piece of that documentation that you fill out, you gather along with your background checks, your insurance. I think that's it for now. Yeah, and then you will submit it all at once through that Next Steps checklist JOT form. And you will only need to do this if you don't have a CPS credential. If you are a grantee who has received funding for the 2 past consecutive years or longer, and you don't have a CPS credential, you have to complete this CPS training tracker form. However, if you do have the CPS credential and you can provide that certificate, you do not need to do the CPS training tracker form. Okay, cool. So now I should be back on my slideshow. So that's a little bit about the CPS. If you are a new grantee that has not been funded consecutively for the past 2 years, you have until the end of October 31st, 2025, to obtain a PPS credential, which stands for Provisional Prevention Specialist. The PPS credential requires the completion of 2 courses on ODP's free learning management system. Those courses are the Substance Abuse Prevention Ethics and Fundamentals of Prevention. You will download, someone's in the waiting room. You will download course certificates of completion and email copies to me. And this is the only time you will be still emailing stuff to me. You will gather up all of your required documentation and submit it through that next steps checklist. But if you're a new grantee that needs to complete the 2 courses for the PPS credential, you will have an extra month beyond the end of October. You actually have 2 months because the required documentation is due August 31st, but the PPS credential documentation is due October 31st. So you have more time to get that done. You will download those certificates of completion and submit them to me via email. And these are just two of the web pages on ODP's web prevention website to give you some more information on all of this. The PPS is a credential that's managed by our office. It's not recognized at the state level, but this is just our effort to help ensure that all of our grantees have the same base level of prevention knowledge. And then encouraging our grantees to get that CPS credential is our way of trying to help bolster the prevention workforce in the state of Idaho. And we will go, I'll show you where to find these web pages on that prevention website later. Okay, now I'm going to open and go through that checklist with you guys. Let me pull it over here. Whoop. Okay, so you guys should be seeing a website now on my screen. Give me a thumbs up if you guys are seeing a new website. Perfect, cool, thank you. Okay, so this is the ODP prevention website. I also want to just throw in there ODP for the last year. We have 2 websites. We have this prevention website, prevention.odp.idaho.gov. This is our website for our prevention providers and our prevention partners. It has more of that information that's relevant to you for our grants, trainings, credentials, all that stuff. And then we also have a more public-focused website called at odp.idaho.gov, and that website is more for the public to provide education on substance use policies in the state of Idaho. And I did want to make a plug. We updated that website. It actually just went live today. This website direly needed to be updated for many years, and we have been working with IT at the Idaho Technology Services, ITS State Department, and a contractor since December of 2024 to get this updated. So, it still has, it just went live today. So there's still some things that need to be polished. So we're going to be working on really fine tuning it for the next few weeks, but I think it looks so much better, and hopefully it's easier for you guys to navigate. So yeah, feel free to go check this out. It has a lot of new updates and search tools, and just it's a lot more organized, a lot clearer, and a lot more visually appealing. So that was an exciting update. But this is our prevention.odp.idaho.gov website. It did not get updated, so it's not as shiny as new. And we were planning on updating it, but I don't know if we will now. And we'll see how we move forward with this transition to health and welfare. But you can find information about the block grant here. So on the home page, there's the block grant application information, block grant grantee information. And this is where I house a lot of the block grant resources. So when I do the recording of this webinar, I will put it, I believe I house it here. So yeah, we'll put it here, and other relevant links and training resources and whatnot will all be housed here. So I want to hop over to this. This is a required SUPTRS block grant primary prevention award documentation information. I sent this out in that email, and this just goes again over the stuff that I just talked about in this webinar: the insurance documentation, the due date, the background check documentation, due date, CPS and PPS documentation. The CPS documentation is due August 31st. Being those confused. And then the PPS credential documentation is due October 31st. And this is where you will find the link for that JOT form. It's there, and I can also I'll include it in that follow-up email I send out after this webinar. But you will click on the hyperlink and it will take you to the SUPTRS Block Grant Next Steps checklist. And I just want to go through this really quickly so you guys can see kind of how it works. There's a lot of conditional logic formulated in it so that it can be tailored to every grantee. Okay. So it'll ask you, have you thoroughly reviewed your SFY 2026 block grant agreement? You have the answers of no, which then a little thing will pop up that tells you to please do that before you continue on. If you did review it and you don't have any questions, you click that. And if you did review it and you do have questions, you have the ability to put those questions there. Next. Then it'll ask you about insurance documentation. So do you need to provide proof of current comprehensive general liability insurance and or workers' compensation insurance? If you guys may remember in the state fiscal year 2026 SFY 2026 block grant application, I added in a new section. This was kind of like a pilot to see how this would work, but I added in a new documentation section at the very end of the application to give people the ability to upload this documentation up front. It wasn't required that you do so. We just have some other state grant partners, and that is how they do their applications and how they gather some of that documentation. So we figured we would kind of give it a try and see how that worked out. So you had the option to upload insurance documentation, background check, and CPS, PPS documentation into your application if available to you at that time. So that's why some of these questions are framed that way. So you can say, no, I provided proof of insurance documentation in the SFY 2026 application. Yes, I need to provide proof of both comprehensive general liability and workers' comp. I already provided proof of one, but I still need to provide proof of the other. And you'll notice that, like, depending on the option you choose, different things will pop up below you. And then, if you aren't able to provide the required insurance documentation at this time, this text box will pop up and just give you the opportunity to explain why. Then it goes into the background check documentation. It'll ask you if you need to provide current dated background checks dated within the last 5 years for all staff that will implement direct services with youth and or vulnerable adults. So you have the option to say, yes, I provided all of the necessary background check documentation in the application, or no, I have not provided all of the background check documentation. So depending on which one you click, it'll ask you a follow-up question. Are you able to upload the background check documentation now? You have the option of, yes, I have all the cleared background check documentation available and I'm ready to submit it. Or no, I do not have all of the background check documentation prepared and available to submit at this time. So then it'll just ask you a follow-up question of, if you don't have it at this time, just explain why. And if you have a time frame on when you think you'll have all that documentation and if you need any assistance from ODP. So, yeah. Hopefully this will be, I'm hoping this is like an electronic support for you guys as you go through this process and going to help answer any questions as it comes up. After background checks, it'll then move into the CPS and PPS credential documentation. So it gives that overview of grantees that have received funding for the past 2 consecutive years and then new grantees. So it'll ask you, has your organization received funding from ODP for the past 2 consecutive years? If you say yes, it'll ask you what documentation do you need to submit? And then the answers, the available resources will pop up depending on how you respond. Oops. There we go. So yeah, that'll walk you through those steps. And I will just highlight that if you say no, your organization hasn't received block grant funding from the past 2 consecutive years, it will give you additional context on, next steps, how to access these 2 courses. The link for our online learning management system, it's housed on a platform called Tavuti. How to register, there's some LMS instructions embedded here and whatnot. So there's support embedded within this to help you guys navigate that. Then next is payment setup. So all of ODP grantee payments will be dispersed to the state of Idaho's payment system, which is now called Payment Works. So it'll ask you if you have previously received grant payments from ODP or payments from any other state agency in the past, and the additional, like, I guess, questions and whatnot will pop up depending on your response. So, yeah, because of the way payment works, they haven't finalized that system. If you pick one of these last three options, I'll follow up with you to provide additional information on next steps. And we will just contact you via the email address you provided at the beginning of the form. And lastly, just if you have any other questions or concerns for this next steps checklist and the required grant documentation, and you just click submit. My recommendation is to gather the required documentation, the insurance, the background checks, the CPS credential or the CPS training tracker form, and gather that all up and then submit it all at once through this form. However, I completely understand if you have some of it and you want to submit it now, and then you're going to get other stuff later and you're going to submit it. So if you end up submitting multiple of these forms, then that's fine. That's not a big issue. But my recommendation would be to gather up all the documentation and then kind of submit this form one time. And all that required documentation is outlined in this PDF that I sent out in that email. And it's also in this webinar recording. Okay, I'm going to now go back to the slideshow. So hopefully you should be back on the slideshow. Okay, grantee responsibilities. So all grantees are required to submit reimbursement requests and quarterly activity reports. This is done via Neighborly. ODP, this block grant is a reimbursement-based grant. So we expect grantees to be able to cover the costs up front, and then they are reimbursed for their services. And that is done through a process that utilizes Neighborly and then a detailed reimbursement request JOT form. And then our quarterly activity reports are done every 3 months, also via Neighborly. I'm finalizing the 2026 SUPTRS grantee process guide, but this will provide step-by-step guidance on how you will sign up for Neighborly, for your Neighborly account if you don't already have one, how to complete reimbursement requests, and how to access your quarterly activity reports. And additionally, I think in past years, this onboarding webinar can be like a fire hose of information. So I am not going to go through Neighborly live during this webinar. I'm going to do a recording of myself and my screen going through the reimbursement request process. And then I'm going to embed that recording into the PowerPoint. I'm going to do the same thing for how to access the quarterly activity reports and also embed that, so that then you'll have that kind of embedded in the copy of these PowerPoint slides when I send them out to you guys. But it'll help save some time here. I will also say that we have a new evaluation services contractor this year. They started, I think, March of 2025, and they are, using this. We're using this as an opportunity to kind of take another look at our evaluation services and how we've been doing that in the past. SFY2025 grantees had the opportunity to complete a survey to provide feedback on grant processes and activities. The contractors, that feedback was invaluable. They took it very seriously, and they are integrating that feedback back into the reporting processes and also our survey processes. But they are making some updates to our quarterly activity reports. The quarterly activity reports are really based on the data that we need from you guys for the reports that we do to SAMHSA, to the federal government. But they are going to be adding in and updating those quarterly activity reports to reflect, the feedback that you guys provided in that 2025 survey. And then they are going to, our contractor, in partnership with ODP, is going to hold a quarterly activity report specific training at the end of August. I will send out details on that date and time once it's finalized. So all grantees are required to do the reimbursements and the quarterly activity reports, but then grantees that implement direct service evidence-based programs will also be required to complete program participant surveys. The 2026 program participant surveys are being updated by our new evaluation services contractor. That contractor's name is TriWest. Again, grantees, SFY2025 grantees completed a kind of a survey for ODP to provide feedback on grant processes and activities. And TriWest, our contractor, is integrating that feedback, and they are updating those survey tools. Historically, those surveys, we had a pre and post survey for younger youth in grades 4 through 5, older youth in grades 6 through 12, and then we had a parent survey that was retrospective. Last year, we piloted going to we dropped the younger youth survey, and we just did a older youth retrospective survey for youth in grades 6 through 12. So my understanding, I believe, is that they plan to continue to not do the younger youth survey and only survey program participants in grades 6 and up. And I do believe they plan to keep it as a retrospective survey, but they are updating that survey. And so they are going to be finalizing that survey update and also the parent survey. And then they are going to be doing a survey-specific training also at the end of August. And I will send out details once that date and time is finalized. And I will only send that training out to grantees that are doing these direct service evidence-based programs. So yeah, we will keep you posted on that. Hopefully by breaking it out into like smaller trainings that are more consumable and not so overwhelming, this can be a high-level overview, and then we will be doing those more in-depth trainings in the coming month. So next, I just wanted to do SFY2026 SUPTRS Block Grant Award timeline. The Block Grant Award start date was July 1st, 2025. That was the first day of the state fiscal year. And then Q1 activity report, that will cover the 3 months of July through September, and that due date will be October 10th. Then Q2 activity report will cover activities completed October 1st through December 31st with the due date of January 10th. Q3 will cover January through March with the due date of April 10th. And then Q4 will be April through June with the due date of July 10th. June 15th is the reimbursement request submission deadline. Please note, this is always a little bit of a point of confusion. While quarterly activity reports are completed and submitted, on that 3 month, you submit one quarterly activity report every 3 months. Reimbursement requests can be submitted at any time throughout the year. You can submit them every week, every 2 weeks, every month, or every quarter. It's however you guys need. However, the last date to submit a reimbursement request is going to be June 15th. That's because ODP, we are required to get all of our reimbursement requests to the Division of Financial Management and the State Controller's Office by like around the 20th. So they have about 10 days to process all of the reimbursement requests on their end and get all of the payments dispersed before the end of the state fiscal year and when those books close. And then the SUPTRS Block Grant Award end date is June 30th, 2026. So again, just know those quarterly activity reports will be done every 3 months, but those reimbursement requests can be submitted at any point in time. And yeah, I'll be sending out that grantee process guide to walk you through the steps of the reimbursement request. We're going to be doing a quarterly activity report training and all of that. So and then website, grantee resources, and Neighborly. So this is the ODP prevention website. This provider information webpage is the webpage I opened earlier. So we already took a look at that. And then this is the link to your to access Neighborly for the participant portal. So you'll log in, and if you are the staff that applied for the grant, then you are already assigned as a user, and the awarded grant will be visible on your Neighborly dashboard when you log in. If you are not the individual who applied for the grant, or you guys did not apply for the grant under your email address, then you will need to be assigned as a user. You'll need to sign up for a Neighborly account and then be assigned as a user to your 2026 grant so that it'll be visible on your dashboard. To do that, details on how to do that are included in the grantee process guide that I'll be sending out to you all in the email after this webinar. So either if you already have a staff that's assigned as a user to your grant, that staff can assign as many users as they need. If there's 5 staff in your organization that are going to be supporting with reimbursement requests and reporting, you can assign as many staff as you need, and it's really easy. But if there's any confusion or you do want ODP to help assign some users, just send me an email and I can assign you as a user to the grantee portal and Neighborly as well. All I need is the email address, whatever email address and first and last name that you're going to sign up or use when you sign up for your Neighborly account. Make sure to give me that email address because that is what will tie your account to your grant so that it appears on your dashboard. And I'm not going to go through Neighborly now. I'm going to do some screen recordings of me going through the reimbursement request process and how to access your quarterly activity reports so you can get a understanding of the layout of Neighborly. And I'll embed those in this PowerPoint and share it out with you guys via follow-up email after this webinar, because it can be a lot to go through it. And Neighborly recently got some updates, so it looks very different visually. So yeah, I'll make sure to, even for new grantees or returning grantees, it looks a bit different and might be a little bit confusing. So I'll be sure to do those kind of screen recordings and embed them here. So, and I have updated the grantee process guide to have all of the new visuals so they reflect what Neighborly actually looks like. Guys, and appreciate everything you do. You guys are the ones who make a real difference. So thank you. I am very grateful for all of you. So have a good rest of your day.